So since you're going to be numb in this area, you're going to be awake for the rest of the procedure. What we're going to do, I'm going to use my laser, which is basically light energy that will help me remove that tissue there. So what I'm going to do is work on the upper part of the frenum attachment, which attaches into the lip. I'm going to start right here at the base. A frenum is actually an attachment of the lips, so it limits the motion of the lip, cheeks, and tongue. Sometimes we get abnormal frenums that attach really high up on the gum line, which could cause all kinds of problems. In Maddie's case was all the way up in between the teeth. We're going to be working on the second part of our procedure. This used to be attached all the way down at the bottom, and that's where Maddie had an aesthetic problem. There's no bleeding underneath, so there will be no sutures or stitches necessary at the end of the procedure. All right, so here it is, all done. How are you feeling? Good, perfect.
Oral surgeon Dr. Sanda Moldovan is here with her teenage patient, Maddie, as well as her mom, Loopy. And so the most important thing of all, Maddie,
yes.
You look great. How do you
Thank
feel?
I feel amazing. Now that it's gone, it feels really great. So props.
So
to
give
Dr.
us a big
Moldovan.
smile because you have a gorgeous smile. And it just
Yeah.
absolutely would never know that she had this procedure.
Absolutely.
Yeah, let's talk about what we're talking about here. We're talking about the frenulum or the frenum. There's kind of two words for this thing, and it's that flap of skin that's underneath the lip. Everybody has one, but sometimes it's just really, really big, and you can see on our model here, that's what we're talking about right there. And I see this a lot in younger kids where it's very prominent. It causes a gap between the two teeth. And even, a lot of the times, as those teeth fall out and the adult teeth come in, the problem takes care of itself, but sometimes it doesn't.
Absolutely, and what we know is that about 30% of the population or of the kids grow up with an abnormal frenum. So what happens is our jaws grow and they extend downward. The frenum never moves upward. So there's a gap between the two front teeth. We can actually fix it nowadays very easily by orthodontics. Moving the teeth together, which is what Maddie had.
Right.
And also by doing the laser procedure, which is so much easier than what we used to have.
I love that. I love that.
So you have the laser here today?
I do, which I want to share with you because
Okay.
it's so amazing.
So you want to show us how it works? Everyone,
Yeah,
we got to put our
glasses on.
glasses on to
Beautiful.
protect our eyes.
That is probably the smallest laser I've ever seen. That's cool.
I agree. So now I'm ready to go. And actually, laser energy does not have any color, so what we have is a red light just to show us where the beam is shining. So as it's beeping, I'm going to cut through this tomato. I'm making an incision. And as I go through it again, it'll go deeper and deeper. If I go sideways, I could actually peel the tomato.
Nice.
So we could have some spaghetti and tomato sauce later.
And some people may be looking at that tomato thinking, well, where's all that massive burning?
Right.
That's the whole point of
Right.
lasers.
Exactly.
It's less painful. There isn't that massive bleeding and scarring that you saw with old techniques, so it's very subtle, just like we saw during the surgery.
Now, another procedure you use the laser for is underneath the tongue. If somebody's tongue-tied, right?
Right.
And we can see that here. It's another frenulum in the mouth, and a lot of people, everybody has one, like the one above the lip, but if it's too thick, it prevents the tongue from coming out, and it can affect a newborn's sucking, and as they grow older, their speech can be affected, and it can be really disfiguring. And as a pediatrician, I'll recognize that in a newborn, and if it's thin enough, I'll just cut it really, really carefully with a small scissors. But if it's thicker, they need to see somebody like you, right?
True. And the nice thing about the laser, oftentimes we only have to use topical anesthetic to
Nice.
cut the frenum. We don't even need to use a needle.
And I love getting this treated early because then the baby can breastfeed and then talk normally, and they don't get teased when they get older.
Yes.
So great new technology, Dr. Moldovan. Thank you so much.
Thank you.